Hi everyone, today's tapping session will be on premenstrual dysphoric disorder, PMDD. Many women suffer from this. It is not premenstrual syndrome or PMS as it's most likely known. It is a much more severe form of that, and it can be quite disabling for some women. Some women experience extreme depression, the inability to leave the house, losing interest in activities that you most normally would like to do, feeling sad, anger, anxiety. Usually once the woman's menstrual cycle starts, then those symptoms seem to ease up. But we're going to focus on doing some tapping to help relieve that even before you start to feel symptoms. It's always great to do some tapping every day if you can. So I'm just gonna put my glasses on. And of course, tapping does not take the place of a doctor's care. So please see your doctor and follow what they tell you to do. I was looking in this book. This is Louise Hay's book, You Can Heal Your Life. And in this book, she has a list of, I'll keep this up here for a second, of probable causes for different types of ailments and aches and pains and illnesses. And then positive affirmations to say instead of these probable causes. So I'm going to read to you what she says for premenstrual syndrome. And again, premenstrual dysphoric disorder is much more intense than PMS. So she says a probable cause, and see if any of this rings true for you. If not, that's okay. There may be other things that come up throughout the tapping session that make more sense for you. Probable cause: allowing confusion to reign, giving power to outside influences, rejection of the feminine process. So think about those things. And right now, think about your PMDD, the PMDD you experience, and where are you at right now with that? Or when you are in the height of it, is it a 10? 10 being the absolute worst that you could feel with it? Or a 0 where you don't feel anything at all, and then this tapping session probably wouldn't be of much use for you. And always have some water before you do tapping, before, during, and after. And there are several side effects. The most common is yawning. So if you're working face-to-face with a practitioner, we don't take it personally. That is a sign of release. Also, crying, could bring up a lot of different emotions. So the positive affirmation is, I now take charge of my mind and my life. I am a powerful, dynamic woman. Every part of my body functions perfectly. I love me. And those things can be hard to say for some of us. So you may be feeling some emotions about that. So we're going to start tapping on the points and just follow along. Either say the words out loud or say them to yourself, whatever you feel comfortable with, eyes open or eyes closed. One hand or two, right hand or left, or both hands, if you so choose. All right? So we're also going to use a technique called choices. And what choices does, it connects, I just want to read my notes so I say it right to you. The negative becomes linked to the positive choices. So we're going to talk about the negative thoughts, and through this process, when you then think of a negative, then the positive choice is triggered, and we want to trigger the positive choices. Okay? All right, so we're going to get started with that. So just follow along. I'm going to keep this book open because I might want to use some of those phrases. Okay, so let's start on the side of the hand. Tap on the side of the hand. And think about outcome do you want from all of this? If my words don't work for you, then insert your own. Or after we do this tapping, you write down the words that work for you, and you could say those instead of the words I use. Take a deep breath and let it out. Let's do that again. Deep breath and let that out. Even though I suffer so much with PMDD, I deeply and completely love and accept myself. Even though I suffer so much from premenstrual dysphoric disorder, so much sadness, so much depression, I honor and respect how I feel. Deep breath and let it go. Even though I suffer every month with PMDD, and it is really interfering with my life, I choose to feel better and to move forward. Eyebrow point. We're going to focus on the negative aspects. All this anxiety of PMDD, side of eye. All of this sadness and depression. I don't even want to leave the house sometimes. Under the eye. I feel hopeless at times. I don't know what to do. Under the nose. It's so hard for me to accept that I have to go through this because I'm a woman. Under the chin. I just want it to disappear, this sadness, this anxiety, this depression. Collarbone. It makes me feel useless. It's so sad. Under the arm. This premenstrual dysphoric disorder. I don't want to have this diagnosis. Wrists. The anxiety makes me feel unsafe. Top of the head, either flat palm, your fingertips, or 2 hands. It's just so depressing to me every month to go through this. I'm hardly living. Let's take a deep breath. Breathe out through the mouth. Where are you now on that scale? Did it go up? Did it go down? If it went up, that's okay, because sometimes that happens with tapping. That means it may be coming out. Or it could have already gone down, which is great as well. Both are great. Neither is right and neither is wrong. Okay? So let's do the second round on the choices, on the positive that you want every month, on the things that you want every month before your menstrual cycle. Eyebrow point. I choose to feel at peace and calm. Side of eye. I choose for my body to feel good and for my mind to feel clear. Under eye. I choose to feel alive and excited and doing all of the things I love to do every month. Under the nose. I choose to feel happy and clear. Middle of the chin. I choose to feel safe in my body. Collarbone. I choose that my body can heal itself. Under the arm. I choose for every month to feel good and to feel clear and focused. Top of the head. I choose for my body to feel good and to feel excited about the day. Let's take a deep breath and let it go. Where are you on that scale now? Has it gone up? Has it gone down? And always remember, even if it went down a point or two, that is success. So you're doing great. All right, so the last round of choices technique, we're going to alternate the negative and the positive. Okay, so we're going to start out on the negative, and we're going to end on the positive. I want to take a quick peek at my Louise Hay book and see her affirmation here. Okay. All right. Eyebrow point. All of this anxiety with PMDD, side of eye. I now take charge of my mind and my life, under eye. All of this physical pain and aching every month, under the nose. It disables me. I can't work. Middle of the chin. I'm a powerful, dynamic woman. Collarbone. During PMDD, I can't enjoy the activities I like to do. I don't even care. Under the arm. Every part of my body functions perfectly. The wrists. Every month, I spend so much time in sadness and crying. Top of the head. I love me right now. And I am worthy of feeling good. Let's take a deep breath in from the lower abdomen and breathe out through the mouth. How are you feeling now? I hope your number went down. If it didn't, you could do this tapping again with words that might make more sense to you. Again, if you're feeling really overwhelmed, please make an appointment with a mental health professional, either me or someone else of your choosing. If you choose to work with me as a practitioner, we could work via video pretty much any time and any place. So that's the convenience of this type of work and this style of work. All right, so if you have any other questions, please feel free to message me or text me, and I really hope this helps. This is a serious disorder with many women, and it has been overlooked for quite some years in time. But anyway, now it's in the forefront, so enjoy. And again, if you have any questions, give me a shout out. Bye, and I hope you have a great day today, and keep tapping.